There was a day where the treatments for mesothelioma was quite limited, maybe a couple of decades ago, and there wasn't much that we could offer patients.
Historically, mesothelioma is aggressive and often treatment-resistant.
And while mesothelioma still is a very aggressive disease, and that much has not changed, our treatments have significantly changed.
Before the turn of the century, mesothelioma patients were often limited to best supportive care and single-agent chemotherapy with modest survival benefits. But a better understanding of cancerous tumors has led to new methods of treatment with more improved outcomes. There are 3 traditional types of ways that we treat cancer. Surgery, which is the process of a surgeon actually going in and physically removing tumors. Chemotherapy, the use of drugs that specifically target the particular parts of the cell where they divide to allow for the cells to die. And then we have radiation. A radiation oncologist will use different types of radiation to destroy those cancer cells in the body.
Based on the stage and the type of mesothelioma, we can then start to think about what kind of treatment we can offer. When it comes to mesothelioma, it's making sure that you have a mesothelioma, and whether it's epithelioid type, sarcomatoid type, or a biphasic mesothelioma. Once we know that, then we want to know what stage is it at. And the stage really, when it comes to pleural mesothelioma, is dependent on how much of your inner lining is involved, whether it's involving the other side, whether it's has spread somewhere else in the body.
Stages 1 and 2 are more amenable to surgical treatment, where it hasn't spread beyond the cavity of the lung, and so it's still resectable. Once it spreads beyond the lung cavity to other parts like the diaphragm, then it becomes a later stage, 3 or 4.
As you can imagine, a disease that has spread is not going to benefit from surgery. Most commonly, patients will require some form of systemic treatment.
Ensuring that patients receive the appropriate treatment and care based on an accurate diagnosis requires multiple doctors from different areas of medicine. This is called a multidisciplinary approach, and it's critical in order to provide excellent care of mesothelioma patients.